The 811 line is actually set up for non-emergency health calls for community members. Anybody can call. Think about perhaps for a community member who may be sitting at home, they are sick. Now, right now with COVID, they're worried. Well, everybody's talking about COVID. I watch TV, there's always new information coming up. What's accurate? What's not accurate? My doctor's closed, I can't call. Or it's the weekend. Where can you get information like this? That's what 811 is designed for, so that the patient can pick up the phone, or the community member can pick up the phone, dial 811, then there will be a nurse at the other end who will then respond to any questions that you have. With the escalation of the COVID, the 811 service received a lot more calls than usual. And also, there's a lot of changes. Even today, we have trouble understanding what the virus does. We thought initially is related to lungs primarily, but we now know there's more than just lungs. It affects multiple organs, stroke, heart attacks, etc. And then we also now learn information about the fact that it's not just for adults, but for children. And so in terms of the number of volumes that have increased, the variation of the information, and also the different testing protocols and whether to be admitted to the hospital or not, that 811 has liked to expand the service to include physicians being available. And so a group of us, very fortunate to be invited to partner with 811 to answer our patients' calls. These doctors call HealthLink BC Emergency iDoctor as an iPhone, iDoctor-in-assistance. The acronym is HEiDi. And so we partner with our 811 nurses. So when there's a patient who calls about COVID, we can then talk with the patients after the nurse has talked with them, so we can further provide accurate information for our patients. So I think what happened is patients need information, especially around this pandemic. It's not something that they can just find on the web. For example, I'm having some symptoms. Are these COVID symptoms? Should I get tested for COVID? Do I need to go to emergency? Am I sick enough to do that? Or should I wait and see my family doctor? All these are important questions, and the patients are rightfully asking those questions. But sometimes they may not get the information fast enough or timely enough. And so when they call 811, not only is there a nurse to support them, but with the patient's agreement or person's agreement, they'll get transferred to a virtual physician like myself or my colleagues, so that we can try to answer all these questions, so that that person will be able to, by the time hang up the phone, know about their own situation, whether they need to see a doctor within 24 hours, or can be followed with family doctors or stay home. But most importantly, the underlying emotions of community members calling is the anxiety, is the uncertainty. We hope that not only can we provide accurate, timely information, but also help our patients to achieve that peace in mind, knowing that it's the accurate information, and when appropriate, we will help them to say it is time to go to emergency or see a doctor right away, so that they don't feel that they'll be in danger. Yeah, it's amazing. We were given the opportunity by the Ministry of Health and HealthLink BC to start organizing services in mid-March. And so we got it started in April 6th. And as of last weekend, which is the 17th of May, we have seen our 2,000th patient that's come through the service. And we've been very fortunate to be able to help out. For those patients who call because of COVID reasons, we're able to have them not needing to go to emergency departments or urgent care center anymore. And they can either stay home safely, or they can go follow up with their family doctors within a week. And so this helped us to decrease the need for these patients to go to the emergency, so it's better for them. And also it's good to increase the capacity of our emergency department and urgent care centers for those patients who need that service. And we're able to call these patients back, And most of them, in fact, 99.9% of them feels that this is a useful service and they are very safe. And we have not identified a case where patients lead into having any adverse problems afterwards. We currently have 30 physicians working together. Many of them are emergency doctors. We also have full service family physicians joining us in this group. And so it's a very interdisciplinary group, interdisciplinary in terms of physicians, so that we work together and making sure that we help patients who are unattached, that they will go back to see their family doctors. If they do have family doctor, refer back to the family doctors. There are opportunities that will continue to need more physicians over time. Currently, we have enough, but I know that over time we'll need to continue to welcome physicians to join us. So if our emergency physician colleagues are very interested, please contact me or contact through BC Emergency Medicine Network. I'd be very happy to hear from you, not only to hopefully engage you in this service together, but also get your thoughts and feedback so that we can improve the service.